Welcome, everyone, to today's webinar, Revenue Cycle Analytics in 2023, Extracting Value Out of Your Expanding Data Universe. On behalf of Deloitte and Becker's Healthcare, thank you for joining us. Before we begin, I'm going to walk through a few quick housekeeping instructions. We will begin today's webinar with a presentation, and we'll have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into the Q&A box you see on your screen. Today's session is being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access the recording. If at any time you don't see your slides moving or have trouble with the audio, please try refreshing your browser. You can also submit any technical questions into the Q&A box, and we're happy to help. With that, I'm now pleased to welcome today's discussion moderator, Sam Johnson. Sam serves as the ConvergeHEALTH Healthcare Portfolio Leader with Deloitte Consulting. And we are also pleased today to be joined by an esteemed panel for today who will introduce themselves before our panel discussion begins. So with that, Sam, thank you again for being here, and I'll now turn the floor over to you and the panelists to introduce yourself.
Thanks, Kelly. I appreciate the introduction. Hi, everyone. Welcome to Revenue Cycle Analytics in 2023, Extracting Value Out of Your Expanding Data Universe. As Kelly said, my name is Sam Johnson. I'm a partner in Deloitte's healthcare practice, and will serve as the moderator for our call today. The vast majority of my 17 years here has been spent in revenue cycle, really working at the intersection of revenue cycle operations and technology. Currently, I lead our healthcare asset portfolio. So sitting in our software development arm of Deloitte called ConvergeHEALTH. In Converge, we have a variety of products solving many of our clients' most challenging issues. The two products we'll focus on today are Revenue Intellect and My Rate Finder. Revenue Intellect is a revenue cycle-focused data visualization tool that helps our clients identify issues and anomalies in revenue cycle operations. And My Rate Finder is a pricing transparency tool used to ingest new payer and provider machine-readable files and draw insights from those data. I'm excited to have an esteemed panel of colleagues and clients alongside me today that all share a passion for data and the insights those data can help generate, as well as the operations they can help impact. I'll have each of them introduce themselves to you during their respective sections, but just to give you a brief overview of who you'll have the pleasure of hearing from, we've got Matt Lund. Matt is the Chief Contracting Officer at University of Washington Medicine. Matt's been working with Chris Murray, a leader in Deloitte's healthcare practice, focused on pricing transparency and strategy. They'll be discussing new data available in the healthcare ecosystem as a result of pricing transparency regulation and how this data can be used to inform strategies on how to improve the economic value of payer-provider relations and the competitive position of the organization. Next, we'll have Aaron Stapp. Aaron is the System Vice President of Revenue Cycle Analytics at CommonSpirit Health. Aaron has been working with Curtis Miller, also a leader in Deloitte's healthcare practice, but focused on advanced analytics, data, and automation within revenue cycle. And they've been innovating revenue cycle analytics all the way through. They'll be discussing new techniques that can be applied to revenue cycle data to generate insights from those data. And last, but certainly not least, we have Deb Wierczak. Deb is the Vice President of Business Support for BJC Health. Deb has been partnering with Lauren O'Hanlon, also a leader in our revenue cycle practice, to put insight into action. They're going to talk about how to utilize the insights generated from the data to make operational decisions that ultimately impact performance. So without further ado, I'd love to bring Matt and Chris into the conversation to talk a bit about how all the new data available and how it's changing the payer-provider landscape. Chris, let me pass it to you.
Yeah, thanks, Sam. Appreciate the introduction. So I'm Chris Murray. I'm a senior manager in our life science and healthcare practice at Deloitte. I'm also the go-to-market lead and chief architect for our My Rate Finder price transparency and pricing strategy analytics solution. I also co-lead our healthcare transparency practice. I grew up, like Sam, in revenue cycle, spent a lot of time in mid-revenue cycle, charge capture, coding, CDI, and naturally have a passion for analytics. The past 5 years, I've been spending time with healthcare organizations across the ecosystem, helping them design pricing strategies to really improve the economics of the system. And one of those systems organizations I'm really excited to be here with is University of Washington Medicine. Close friend and colleague, Matt Lund, for UW Medicine. We've been working together for over 5 years, spending a lot of time poring over this type of analysis. So Matt, I'll let you give a quick introduction before we jump in.
Sure. Good morning, everyone. My name is Matt Lund. I'm the Chief Contracting Officer at UW Medicine here in Seattle. We're a 4-hospital system, or I should say 3-hospital system, 2 hospitals operating under 1 license in there. We've worked with Deloitte on pricing strategy for the last several years, finding great success and consistency, building a sustainable pricing program at UW Medicine as we've gone through with Deloitte, and working on utilizing some newly acquirable information as well, which we'll talk about related to machine-readable files.
Thanks, Matt. So it should be no surprise, pun not intended, that there are many new sources of pricing data that are emerging in the ecosystem at an accelerating rate. So for those that have been at this for some time, you'll even remember prior to 2019 when this curve was really below the line, and there was really no market data at all. We had some limited data set data from CMS. There were some blinded data sets, but really no understanding of what payer-provider prices looked like. That changed in 2019 with the first regulation to post hospital charge masters, and as we all know, that was not particularly helpful. What really changed things was in 2021 when we started to see with provider healthcare transparency, very specific healthcare prices illuminating what payer-provider negotiated rates looked like at a very granular level. In 2023, so where we are today, right, fast forward 2023, and we have an explosion of data. And we're talking, right, hundreds and hundreds of petabytes, more data than what's in the Library of Congress, right? And so that's created a real analytics spring for pricing strategy and other pricing use cases, which, what brings us today, which is really, the hard part, which is, what do we do with all of this data, right? How do we get to what's essential? How do we figure out what it means, right? How do we actually apply it? And we're doing that across, many use cases, right? So today we'll talk a little bit about pricing strategy use case, but we're also seeing, shopping use cases and shopping use cases across the different customers. So not yet, patients actually shopping using these machine-readable files, but we are seeing employers and payers starting to use this data to make shopping decisions around networks and products. So it's a really exciting time for the pricing space. I think we have a lot of work ahead of us. So we're excited to have this dialogue and answer questions around the use cases. Sam, back to you for some questions.
Oh, I appreciate the overview, Chris. Matt, I'm going to pick up something you said, or maybe Chris, you might have actually alluded to this, but it sounds like you guys have been working together for going on 5 years. Matt, I understand you guys have had a lot of organizational focus on pricing strategy for quite some time now. I'd love to know more about kind of the overall evolution of the program, and specifically, how has the access to new data changed what you do?
Mm-hmm. It's a great question, and I like your use of the word evolution because I think that really describes what's gone on. When we first engaged with Deloitte, we were operating with with different hospitals within our system, each with different pricing strategies, different pricing processes. That while they were all reasonable individually, there wasn't really any kind of synergy between them, and really there was a danger of things kind of conflicting with one another. We also knew that, at least the word on the street at the time, was that there was going to be some pricing transparency going on, where those charge masters would be much more visible to the public, and we wanted to make sure that what we thought was a reasonable practice actually was when viewed together and by industry experts. So we engaged with Deloitte to go through overview of all of our pricing strategies for all of our hospitals, and benchmark those prices against similar comparator hospitals across the Seattle area and the West Coast, to really test the reasonableness of our pricing, and then look for opportunities to improve incremental revenue growth where we could, and really build something that would be sustainable for continuing to manage our price setting process moving into the future, to both be defensible to any people in the public, particularly the people that we serve. We have public hospitals, and we want to make sure that we're doing right by the public as well, not just being reasonable, but appearing reasonable to anybody who's going to be looking, but then also to improve our ability to capture revenue where we can.
Oh,
yeah, I love that word sustainability, Matt, because you're right. I mean, I think what's important, especially for anyone in the audience that's thinking about starting a new pricing program and starting to look at this data and figure out how to use it, is you need to build a strong foundation. And what I really respect about UW is they took the time to build the org structure and the op model to be able to digest all this data and make decisions in a meaningful, sustainable way from the analytics. And so that kind of takes two pieces, right? First is an actual pricing strategy. And so like Matt said, for UW, that is the principles that they use to make pricing decisions, right? That they want to make sure that you have a fair price, right? That is consistent across the system. And then ultimately, these are profitable decisions that are going to be able to serve the customers or the communities, right, that they serve. And so in doing that, right, the data, what we're kind of all here to talk about, is like there's three important levers when we think about pricing strategy. There's value, which is I think we all agree is the most important, which is kind of quality, access, experience. You can look at net promoter score. You can look at your CMS star ratings to kind of get a sense of quality. Then you have cost, right? Your unit economics and the cost structure and what's a viable price. But then this new really kind of exciting element, which is really expanding, is then market, right? What's the market able to bear? What's the market going to tolerate? And 4 years ago, we were using CMS blinded. Truven had a product. But it was very, very kind of high level. Now we're able to get super granular into what are the payer provider combinations so that we can understand and really be able to see the market landscape and really optimize the value around the pricing strategy. All the points that Matt made.
Well, Chris, since you've got the mic, let me ask you this. I've heard that it's kind of the wild, wild west out there with these payer MRF implementations. Can you tell us a little bit about what that's been like?
Yeah, I would emphatically say yes. It's definitely the wild, wild west out there. And I was serious when I said explosion of data, right? And the question is why, right? Why is it so hard, right? Why is it so hard to extract data from these files? Why are they so huge? And I think on the question of why is it so hard, right? I think for those that spend a lot of time, I think many of on this call do, it's not easy to report prices, right? We don't have the systems, we don't have the reimbursement methodologies, don't necessarily suit themselves to a machine readable file or Excel file. So it's challenging just to organize the data. But then also there's no incentive, right, to make these machine readable files that are for use for competitive dynamics and for aggregators to be user friendly. So ultimately what you get is a ton of data in a very unusable fashion. And so then we have the question of why so large, and let's just use some easy numbers to kind of start to understand the scale here. So for one provider, when we think about the provider price transparency, right, we're talking in any CDM, right, you may have 50,000 items and services, and that's across 100 different products, right? So now we're talking for one hospital, one MRF, maybe 5 million different rate values. And 5 million, that's not that big for those of us that work in analytics, right? It's it might not be in an Excel workbook, but certainly easily manageable in a SQL database. So then let's talk about plan. Plan's a little bit different, right? Let's talk about that same provider, right? So we have 50,000 items and services, right? Supplies and pharmacy. And now you take 10 products. Now you have 500,000, right? For one plan, right? For one provider. Then you have a national network of 3,000 providers. We're now talking about 1.5 billion rates. And then they start repeating that over places of service. So now we have, let's say, 10 places of service. We now have 15 billion rates. And now that can be duplicated over NPIs, right? Sometimes a provider can have in the MRF files 10, 20, 30 NPIs over employers. Like now we're talking thousands of employers. So now you can easily start to see, right, how this starts to balloon into a database that's the size of the Library of Congress. And so, why is it important to kind of understand the scale? Well, that scale creates a lot of noise. And so we have a ton of data, right, a ton of noise. How do we get at the meaningful components, the essential of that? And I think, Matt can talk about here, it takes a good team, right? We need to really be able to understand the data. You need a toolkit, right, of analytics to be able to normalize and mine for what's essential and then identify the trends in that essential data. And then you need a team that's really understands the market, understands the competitive forces and the reimbursement methodologies to be able to then interpret those trends in a meaningful way. We like to say, right data, right analytics, right assumptions, drive the right conclusions, and then action, right, and ultimately, get the value from it. And so, me and Matt spend a ton of time with our teams working through, very closely understanding the underlying data and interpreting what we're seeing and be able to throw out what, doesn't make sense and keep what's meaningful. And so, Matt, I'd love to, you talk a little bit about some of those critical success factors of our relationship and what our team's been spending so much time doing together.
Certainly. I mean, you used the term petabyte earlier, and I was joking with you the other day. I don't think I'd heard the term petabyte until we got into this process. In other words, there's just so much data that's in those machine readable files that to be able to get through that, you really do need the assistance of some experts, but in particular, all of the data in there, much of it is useful and some of it is really just noise, zombie data, as we've been calling it, that isn't going to be helpful. And of course, every plan, every payer that has posted has done so a little bit differently. And so working with Chris and his team, we've been able to sort of sift out the noise and get at what really is valuable to our system. And getting to that point to be able to actually see where we stand in the market helps us to be able to more coherently make our value case to our public. Precisely because we can understand where we stand a little bit more clearly against our competitor hospitals for different service lines, for pricing and cost overall. And it allows us to think a little bit more clearly with better strategic opportunities to be able to take different ideas to our market. One thing that stands out, in the work with Chris and his team is that there are different ways to review the data, obviously, but to have my team's view of the local market leveraged with Chris's team, the view of how they've worked with other similar systems throughout the country, really do help us to come to better informed decisions when we're using this data. I'll also say that over time, the data that has been posted has started to improve. You can imagine the different insurance companies, put only the bare minimum amount of data up on the machine readable file to start, and they've improved that over time. And so each time we look into the file, or Deloitte looks into the file they help us look at it, the picture improves a little bit to make it a little bit more usable.
Yeah, Matt and Chris, is it fair to say that the complexity that is the data set and the amount of hours and effort that go into this is somewhat streamlined or made easier through utilization of the MyRateFinder product or tool? I mean, is that helping normalize data or at least ingest and deliver insights?
Absolutely. Without that help, we would not be able to compare apples to apples. I can only imagine the situation we would be in if we had tried to crack open that file and really tried to do it without the help of subject matter experts. It really does help to get us to a place where we're able to utilize that information, compare it across different companies, and put it into use right away. And so it really helped to sort of bend time to be able to work with Deloitte and the MyRateFinder tool to be able to do that.
Oh, that's awesome. Matt, and I know we're running out of time here, but if you can leave the audience with one pearl of wisdom on, I'm sure we've scared off half of the crowd here, but if there's a way to make how do you get started? How do you launch? I assume people are probably dealing with all this complexity and all this data and trying to figure out just where to get started. Maybe you can offer a bit of advice on that front.
Well, I think curiosity is a good place to start. I suspect that every single person out there listening who has a job similar to mine has always been curious as to what the reimbursement rates are for your competitors in the area. It's always been an undefined, undefinable variable. Really, it's come down to a lot of hunches. We think we're paid more or paid less than a certain hospital system or something. That curiosity, I think, in filling in, everybody who does contract negotiation, for example, understands the value of understanding the market, and this really does help to define that variable. And I think that sort of figuring out how that information might help you make progress for your system is a great place to start, and then finding a partner that can help you make sense of all the information that's out there. As Chris said, really the transparency efforts were perhaps nominally intended to help individual patients, but really what has happened with these regulations is that it's created this huge pool of data that's intended to be analyzed by groups that can process big data. And that's exactly what we've got with Deloitte's help.
Excellent. Matt, Chris, thank you so much for your time. Much appreciated. Love hearing your vignettes and stories about what you guys have done in this space. I'm going to actually pivot us over to more traditional revenue cycles analytics and talk a little bit with Aaron and Curtis around how to actually drive value and create impact by employing new techniques with the data that's now available. Curtis, can I turn it over to you?
Sure thing, Sam. And hey, team, excited to be here with you today. My name is Curtis Miller. I'm a senior manager in our revenue cycle practice like Chris. I specialize in assisting clients in using analytics to answer their operational questions and improve their revenue cycle operations, be that through traditional business intelligence, intelligent automation, or some of the artificial intelligence techniques you can see on the right of the page here. I also help translate those industry problems that we hear about into our products and features in our ConvergeHEALTH portfolio. Joined today with Aaron Stapp from CommonSpirit. Aaron, do you want to give a quick introduction on yourself?
Sure. Good morning. I'm Aaron Stapp. I'm Assistant Vice President for CommonSpirit in Revenue Cycle. Really, my areas of focus with CommonSpirit are really around analytics and data, as well as financial issues within Revenue Cycle and cognitive innovation.
Perfect. Thanks, Aaron. So I'll be kind of given the theory at a high level, but I'll get out of the way and bring Aaron in to provide some anecdotes on his experience at CommonSpirit and how he brings some of these techniques to life. As we think about what we just spoke through, data, the expanding universe of data, naturally data becomes an input to analytics. Having more data unlocks the ability to do more advanced analytics, and we will certainly get into what's new in the analytics realm. I do want to focus us in on the desired outcome of these revenue cycle analytics, because I think it's really important that analytics leaders consider what is their organization trying to do And how can I use that as a prioritization method for determining what analytics I'll produce? So, you first want to align on what the goals of your revenue cycle are. These three we have on the page are pretty common ones. You may have more specific ones. You may weigh them differently. But as you think through what analytics I want to produce, make sure that it is kind of running towards and with the goal of, is it going to help me optimize my revenue? Are these insights going to help me contain cost? Are the visualizations that I'm producing to the team to let them make decisions going to increase patient satisfaction, or whatever your portfolio of goals would be? Folks tend to get ahead of themselves and start building out things down at the bottom of the page, and that's very exciting, but kind of keeping those goals in mind as you establish your analytics portfolio, very important to kind of connecting that to operations. So Aaron, I'd love to bring you in and kind of get your thoughts on goals that maybe you had as you started to set up your central analytics team, and kind of how you approached that challenge.
Yeah, sure. So to give you a little background, right? So CommonSpirit Health was the merger between Catholic Health Initiatives and Dignity Health. And so if you think about that, both systems had fully outsourced the revenue cycle areas, right? So there really wasn't much of an analytics function. And so that was one of the areas that we identified as really being needed, is to bring really robust analytics in-house so that we would have better insight and really could holistically understand our revenue cycle performance, as well as other areas that are impacting our revenue cycle. I think the other part of that we were thinking is, when you don't have access to information and data, right, you're allowing someone else to kind of tell a story and drive the story from their perspective. And so that was definitely something that was important to us, is to be able to do that and understand it with our own data. And so going down that path, is that kind of being the starting point of, we really needed to kind of build from the ground up. I would say we're mostly from the ground up, right? And so we wanted to be able to bring data from all different aspects, right? So we had data from obviously our patient counting system, and then we wanted to bring in reserve data. We wanted to bring in managed care data and expected payment data. And so we were able to do that internally with our own kind of business intelligence and data warehouses in place. But really where we were lacking data that would give us much more insight was really around our EDI data, so our 835 and our 837 data. And so that's where the use of the tool Revenue Intellect came into play. We decided to use that tool. We had used it, we had just started really using it at Catholic Health Initiative. So we implemented that tool. Kind of the beauty of that tool, I would say, is it links all that EDI claim data with your patient accounting data, which really starts to allow you to give much better insights into initial denials, kind of payers and how they behave, and disparities between payers and regions, right? As well as the other big area of insight that it's helped us with is really understanding the patient responsibility portion, like what amount is getting assigned to the patient? How is our performance and collections around that? How does that vary between payers and region? And so really getting that insight was some of the reasons we went into Revenue Intellect. I think the other things too it helped us do was really standardize our data, right? We have, I think, more than 10 different EMRs, and of course then they're on a bunch of different platforms. So there's a lot of different systems with disparate data that we needed to standardize and normalize to be able to centralize the analytics and really gain insight into that. I think the other big thing, like if you internally try to do this with your EDI data, it becomes quite a bear, right? Not only because just the volume, but also you get multiple claims data on one account. And so how do you handle all the multiple claims to one account? So Revenue Intellect also highlights the claim of most importance for us. And so really you're able to hone in on the claims data that is most relevant to that claim. So those are kind of the things that where we started to, and how we came to need and use Revenue Intellect as a great tool for us.
Awesome. Thanks, Aaron. So kind of with that data normalized, with that data in place and kind of executing against goals, I mean, what that unlocks for leaders in an organization are all the things listed here. So want to highlight just very simply a couple of new things in traditional business intelligence and analytics techniques, as well as allude to some of the early steps in that artificial intelligence space and kind of where we're going here. So reports and dashboards, right? You don't need me to define that. That's something that folks have been executing on. Back when spreadsheets were on paper, right? We were drawing up bar charts, we were providing insights. But I think there's some improvement in compute power, right? Matt alluded to petabytes of data. Imagine deriving insights from petabytes of data even 3 years ago. It was near impossible. And kind of the other advancement that we're seeing is more and more democratization of data and insights. So allowing user self-service through more mature business intelligence tools, it really unlocks, your end user's ability to get answers to questions that they have. And then B, analytics teams are able to produce more, to provide more to the organization because they're not the holders of the keys for all reports. One other thing I'll highlight is kind of cohort analysis. It's a classic concept. That's the idea of, as Aaron alluded to, maybe segmenting by denials in a specific region or denials by a specific type, but definitely one that's advanced in our ability to segment. We can inform insights at a very granular level. We can answer more detailed questions. We can give business users the ability to kind of double click into the numbers and the data they're seeing to find that target population. So Aaron, I know you had an example around payer scorecards and maybe how those have evolved. Quick overview of what you all are building.
Sure, yeah. So that's been one of the nice things in revenue analytics, right? Payer scorecards. I don't think that's a concept that's new to anybody, right? They've been around a long time. I think what's been nice for us is just our volume of data, being able to automate that within revenue analytics. And so building those out and being able to compare, our payers at a region level, right? I think we're in, 20 plus states. And so payer and payer performance and payer behavior is very different between those states. And so being able to isolate that and drill down, have an automated way to produce a payer scorecard where you can compare those payers as well as bring in that EDI data and start looking at, okay, who has a higher initial denial rate and who's increasing their ADRs and how are those payers, are they pushing a lot of that contracted rate to patient responsibility that of course we don't collect as well on. And so really your contracted rate's, different than what you think it is. And so having all this type of insights been very helpful. I would say that's been a big plus for us. That's something we've been able to do with revenue analytics.
Awesome. Thanks, Aaron. One last highlight on the left column very, very quickly is process intelligence. So this is something that falls under your traditional descriptive analyses, but it's a new technique that a lot of folks are leveraging. If you have Epic or you have another modernized patient accounting system, you're likely getting a log of every user's click to accomplish the cycle. And there are new techniques, new products that actually can line up that account's life cycle. So you can compare different accounts and say, well, one got denied, one didn't get denied. When I look at the user activity all lined up, it seems that the fork in the road is, did I get a prior authorization? No, those are getting denied. Yes, those are not getting denied. So it's a really cool, innovative technique to start to dig into the actual work that goes on to drive the outcomes, and definitely something we're seeing emerge. Moving over to the right side of the slide, the one that I do want to highlight, just given the time that we have, is anomaly detection. It's one that we're really, really excited about, and it's kind of expanding the bounds of what revenue cycle analytics can do. So anomaly detection is the concept of using artificial intelligence to monitor your operations and flag deviations from the norm. So in general, if we were to analyze an organization's denial rate for a specific region from a specific payer, we would see up and down ticks, but we would be able to establish what normal operations look like. It's a ton of manual effort to identify where are things deviating from the norm. It takes time. It's not in real time. And we can only deploy so many eyes against that problem. Well, with artificial intelligence, you can use algorithms to establish that mean, those standard deviations, all the statistical terms necessary to say, oh boy, yesterday, this denial rate spiked in one of my regions and I need to look into it now. It's a really cool technique. It can be deployed against almost any metric with any amount of slicers and dicers, and it really pulls forward your analytics team's ability to react in real time. So, Aaron, this is an emerging technique. I know you and the team are kind of working with the Revenue Intellect team to deploy this, but kind of any thoughts on how you all are progressing to deploy that rev cycle mission control?
Yeah, so we've built a good base of data, right? And we have awesome insight, all kinds of data. And if we get requested for something specific, we can go pull it and really have, I think, a great sense of the data and access to the data. But really where we're trying to get to is that next step, right? Like if you think about it, like I think we have millions of accounts, tens of millions of transactions, right? And so if you think about that, trying to just look through like normal analytical reports and getting insight, and it's hard enough, right, to catch something after it's occurred. And so this is where we're trying to take that next step in the evolution of, hey, can we identify these trends ahead of time and point out, our operations team is so busy with just the normal operations, regulatory issues, like there's constant stuff that they're dealing with. To have them try to dig through, okay, here's a standard report. Can you look through this and identify trends or issues, right, that are unknown? So this is where the next step we're really trying to get to, where can we use artificial intelligence to help us identify those trends and those issues? So we've been working with our operations team to kind of build those rules on, okay, can we use this AI to detect, do we have a spike in ADR requests for a specific variant in a specific facility, or other things that it can highlight for us and identify before they become an issue, right? So it's really that next step that we're excited about. And we're still trying to figure out like the best way to use it. But that's definitely the next step we're trying to take that we're definitely excited about.
Awesome. And Curtis, Aaron, I don't know if I can jump in here, but that point around how do we use anomaly detection, and maybe Brooke, stay back on the previous slide, but how do we use that technique? I wonder if that actually brings up a broader point around analytics, which is, you can run all the math and the data and draw as many insights as you want, but getting people to actually consume those insights and make change based on that is a whole nother story. Aaron, can you talk a little bit about it, given the complexity of your organization at the scale? I'd love to hear kind of your experience around, trying to get people, to actually understand, read, digest, and make, react to the insights you're providing.
Yeah, I think that's one of our biggest struggles, right? Is like, we have a phenomenal amount of data. I'm proud of the data and the insights that my team can get, right, from the tools we have and what we built out. But it's how do we make it meaningful? How do we get operations to be able to leverage that data and change our performance and improve our performance, right? And be ahead of the game and not constantly behind, instead of trying to explain after the fact, like, why is cash down, or why is denials up, or, try to get ahead of the game so you're recognizing an issue beforehand and solving it. So I would say that's something we're definitely working through. I would say that's one of the biggest challenges, right, is how to engage operations to make it the most meaningful for them as part of their regular process.
Yep, absolutely.
So not really an answer, right? We're in the process of figuring it out.
More of a shared, we're all in it together. We're all trying to solve the same problem. No, that's excellent. All right, so only because I read an article on ChatGPT on the plane yesterday, I'm going to ask this question. But if you fast forward 5 years, data's normalized, operators are digesting the data, these techniques are mature, you guys have figured out anomaly detection, how to use that. Where do things go from here? And Curtis, I'd love to know your perspective as well as Aaron's on, where does it go from a academic perspective, or how we actually bring this to life for clients, as well as from a client perspective, like what does it mean to you if 3 years from now, where is RevCycle from an analytics perspective?
Yeah, and thanks, Sam. If anybody wants an entertaining read, and maybe you've heard of ChatGPT, maybe you've played with it, go Google it and follow it to the website and ask ChatGPT to write you an appeals letter for a non-covered services denial. And I think you'll see that now with some of these techniques. But Sam, I think there's a continuation of the trend, right? The data universe is not done producing additional petabytes of data, right? We're going to be able to structure documents, pieces of paper, scanned images, medical records, and that's going to unlock all kinds of new analytics techniques for the team to use. I think it's going to be important for analytics teams to do exactly what we said at the start, take a step back, because you're going to be able to produce so many insights. And I promise you, your operational counterparts are going to ask for all of those insights. So stay focused on the goals, use the right techniques for the right problem, and just continue to democratize that user self-service and let them kind of answer their own questions where they can. But Aaron, anything else that you see heading up with the revenue cycle that'll affect analytics in the next 5 years?
Yeah, I mean, I think my hope is, right, when you talk about unstructured data and other things, is we're really, what I think is holding us back is all the manual human intervention, right? So we're trying to use math and machine learning and stuff to be able to really leverage these analytics. And so I would hope we're in a place where we get to a point where a lot of these processes are automated that don't require human intervention. I think that would really allow us to get the most out of a lot of these technologies, right? I mean, when we've looked at machine learning and stuff, there's always a percentage of the claims based on your history, machine learning said you have a very low percentage of winning these appeals, but you kind of have to trust that the processes you have in place are followed every time the same way, right? And so that's where I think what always kind of scares us, every percentage of our revenue, for most health systems is so important, right, as we're working on such tight markets. So that's kind of where I'm hoping it goes, so we can really move kind of these next steps with advancements in analytics and innovation.
Well, that's excellent. Well, Aaron, Curtis, thank you both for your time. As a fellow data geek, this part of the revenue cycle really excites me, and where we're actually going to move in the next 3 to 5 years is also super exciting as well. So I appreciate you guys spending a little bit of time with us talking through that. I'm going to move us forward and bring Lauren O'Hanlon and Deb Weircheck to the stage. As we were talking about with Aaron and Curtis about this idea of, hey, we can generate all the data and the insights needed, but if people don't actually take action based on that data, it's all for naught. And I think Lauren and Deb, you guys have a lot of perspective on how to actually operationalize some of these insights to result in meaningful impact for organizations. So Lauren, can I hand it to you?
Yes, thank you, Sam. And hi, everyone. Thanks for spending this time with us today. I'm Lauren O'Hanlon. I'm a senior manager in healthcare practice at Deloitte. Like Sam mentioned, I've been with Deloitte for 11 years now, leading tech-enabled rev cycle transformation work. So everything from back in the day, HR and CRM selection and optimization, to now advanced analytics and automation and insight-led workflow change. I'm here with Deb Weircheck, who, as you know, is the VP of Business Support at BJC, and that includes all things analytics. I've had the privilege of working together with Deb at BJC now, excuse me, for a few years. We're excited to have her share her experiences with you all today. Deb, do you want to do a quick introduction, and then I'll get us started in the conversation?
Sure, I can. Deb Weircheck, I've been with BJC about 23 years. BJC's healthcare system in St. Louis and metropolitan area, 11 hospitals, $5.3 billion in revenue. In terms of my areas include analytics, as Lauren mentioned, as well as I do have the training and quality area, a small PMO, which works very closely with the analytics, technology team internal to revenue cycle, the revenue integrity group, as well as kind of a unique group called our hospital liaisons, which is a group of project managers who provide communication between our revenue cycle and our operational hospital leaders, whether it be for revenue integrity, charge errors, multiple things, as well as just sharing our operations and our KPIs and analytics results with those hospitals. The liaisons do handle that.
Great. Thanks, Deb. And I want folks to kind of remember those different top focus areas that Deb has, because I think it's so important as we'll start to talk about getting started, piecing the training, as well as the different hospitals, as well as the core central analytics team. So we'll talk about that in a minute. But, Deb and I are going to talk about how you get started with taking action using all the advanced analytics we've been talking about thus far. I started my career in healthcare as a service line analyst at the Hospital for Special Surgery back in the early 2000s, really trying to figure out how much variation we had for a total knee, et cetera. And I was using a mix of green screens and Crystal reports in Excel. And, I now lead rev cycle transformation work at Deloitte. And while my enthusiasm for data-driven action has absolutely remained the same, the data that we have available to us and the way that we can employ it has drastically changed, as Aaron and Curtis and Chris, Matt, Sam have all articulated. Rev cycle in particular obviously has ramped up exponentially, given the tools and teams we have at our fingertips. And, there really are two components to it. First, is the insights we've really been able to extract has changed. We can now translate more insights into action-oriented steps, either informing automation or taking action using those advanced analytics. Now once we have the data, we need to do something with it and set up the right infrastructure to be able to use it in a way that creates action, make it sustainable, more importantly. Deb, you and your team have had a ton of success this year leveraging data and analytics to improve rev cycle performance. Can you share a bit more on what has allowed you to progress and really be successful in your analytics capabilities?
Yes, and I'm going to begin with a little background on our revenue cycle. So it wasn't until late September of last year that all of our hospitals are now on Epic. So we are functioning in a world where we deal with multiple systems through with a lot of providers these days. So multiple of our facilities had been on Cerner Sorian. We've been transitioning to Epic over the last couple of years and also have a hospital on Meditech. So addressing our analytics on these multiple platforms was and continues to be a priority so that you have appropriate comparability. Initially, we used Tableau quite a bit, and then candidly, that gets you only so far deep into the data. And in our partnership with Deloitte, we've used a lot more in terms of the revenue intellect to be able to get into the more transactional detail, whether it be a lot of the EDI transactions, the RARCs and the CARCs, et cetera, the 835 data, as some of our other presenters had mentioned, but also into our staffing transactions in terms of what the staff is actually doing and looking at their comments and their activities and doing that analysis in terms of the touches on accounts to look at opportunities as well. For a number of years, we have used key performance indicators and have an executive scorecard, and that's kind of our overriding guidance. But about 3 years ago, we actually went in a step further and kind of did what we call functional KPIs. And that's actually having metrics for each functional other area, whether that be patient access, HIM, revenue management, and revenue integrity. We use those documents internally as well as with our hospital stakeholders to look at opportunities and to help identify those projects, whether they be in denials, whether they be in productivity, any of those various areas. Using those KPIs, some of the examples that I mentioned, we actually expanded in terms of avoidable adjustment dashboards, and another one in terms of vendor performance reporting. And in terms of vendor performance, that's a good example to talk about a little bit because every vendor will provide you with reporting, and their reporting is going to be based upon their systems and how they're accustomed to reporting. But if you're using more than one vendor to provide the same service, if you could utilize your own analytics, you could ensure that you're really getting comparability into that data and ensuring that the vendors are meeting their service level agreements, as well as just even basics in terms of processing invoices, et cetera, and then looking at their performance and their comparison. Lauren had also mentioned in terms of kind of our team structure and that the areas I have, and I think it's beneficial in terms of how those teams work together because you can have an analytics team issue a lot of reports, but I think the importance of our team structure is kind of the use of those analytics and that data. So I mentioned that we have this group of liaisons. So the liaisons, for example, have led our denial prevention task force and sub-teams in that area. They work with all the leaders within revenue cycle, revenue management, patient access, et cetera, as well as with the hospital leaders. So they have that direct relationship with the hospitals. As all of the revenue cycle areas have consolidated, over the years, I think some of the hospitals felt a little more removed. And a question that came up on one of the other presenters of, well, how do you still impact those operations? And I think those liaisons have helped do that because they still have the relationship with the people in the hospitals that in some case may be involved in OS. There may be trends with a particular physician that we can address, whether it be on documentation and HIM or other various aspects. So we use those liaisons to help identify projects and to help resolve. And I mentioned having the PMO team to kind of manage some of those projects. And then as those opportunities are identified, then I also have the training and quality team that it may be a training issue in a particular area within revenue cycle that we can address to get more consistency and improved operations. So that's kind of how all those areas are kind of working together, as well as with revenue integrity being various charge errors and items that come up on the revenue side.
Yeah, no, thanks, Deb, for that kind of overview on how you set up the infrastructure and how the team's working together. I think it's been, integral, not just from, leveraging our RevIntellect data or other data to create actual insights, but also in managing across the training team, as well as the liaisons that you mentioned across the hospitals, as well as the core rev cycle team. I know, that really worked well from our perspective in terms of helping to support performance improvement. So maybe, do you want to talk a little bit about the specific areas in which you've been able to make impact, whether it's, the denials prevention team structure or kind of payer scorecards and analytics? I'd love to hear a little bit more about, those types of things as well.
Yeah, so in terms of, I'll begin with denials. That's probably what we did kind of early on in terms of our projects with you as well. And in terms of using RevenueIntellect so that we could look across those various patient accounting systems to identify where there were opportunities for denials. Sometimes it's a matter of going down a particular road and finding out that there really isn't an opportunity because we'd like to say our payers consistently use their codes, but they do not. So determining kind of that normalized data and where there is opportunities and how they can be addressed. And in doing that, there was multiple kind of sub-projects that resulted. Overall, just over a year, is probably about $13.8 million in denials recovered, whether that be on missing attachments, things in discharge status, teams in documentation, selection of insurance, et cetera. And using a lot of that RevenueIntellect data, we were able to identify the issues. And not just that, I think something that I think in kind of making overall healthcare that we've not been as good about over the years is continuing to measure things going forward and continuing to keep those gains. You could fix it today, but can you maintain it and continue to keep those gains? So using that tool has helped us to continue to measure those areas to ensure that we're maintaining those gains that we identified. Another area we used, I had mentioned in terms of our last 6 hospitals went live on Epic to the end of September, is we've kind of used that to measure the various waves of go live. We've kind of done it in 3 waves: our initial hospitals, then the academic facilities, then our community hospitals. We were able to kind of do some various metrics along the way, kind of comparing the waves and comparing each hospitals to ensure that we were meeting our operational needs as well. And candidly, they were very successful in terms of doing that.
Deb, I got a question for you. So I know that we've used RevenueIntellect to set up infrastructure. I know we've used it to empower the liaisons and connect the liaisons to the training that's under your guidance as well. So that's a lot of how we've gotten to kind of the operational changes. But I think one of the things that keeps coming up, no matter who I talk to in the industry right now, is around payer issues and delays in payment and reimbursement. Can you speak to a little bit about how you guys did the investigation, how you figured out there were some, bad behavior from payers that had to ultimately get solved for?
Yeah, it was interesting because when we're seeing some lower cash, you immediately look to denials, and we were addressing that, and candidly, our denial rate wasn't going up. But what we did, one of the kind of the unique analysis was looking at the number of touches to get to an account resolution. And then some of it being, okay, is there items that we can assist training our staff to reduce the number of touches to get to resolution? Or were there cases that it was the payer delays? And then based upon those payer delays in those analysis, we've done a significant amount of work with our managed care contracting, JOC, operating committee meetings with the managed care plans to specifically identify the issues. And it's been helpful not to have just an account by account, but be able to use these analytics to say, here is a bolus of accounts, and here's what the issue is, to provide to the payer to have them address it more expeditiously.
And Lauren, I know from a RevenueIntellect standpoint, you guys were helping Deb kind of use RI to generate some of those list of accounts and do some of that investigative journalism, if you will, prior to those JOC meetings?
Yeah, and I have to say, Deb and the BJC team have done a phenomenal job, over this past year, really setting up the infrastructure to pull those insights, that we've been pulling from RI to actually share with the payer instead of, again, sharing one account or two accounts, really cohesively looking at each payer, one by one.
The other thing that I think is maybe a little unique in our structure within revenue cycle, we have what we call kind of our high reliability system, where it's actually a group of huddles that are very short, 15 to 30 minutes. Some areas meet daily, some meet 2 to 4 times a week. And they actually begin with staff and supervisors and leaders, leaders and directors and VPs, and literally VPs with the chief revenue officer. We meet 4 times a week. And if there are issues or anomalies that we're noting, it can literally be escalated very quickly. There's also a number of metrics that are embedded in those daily meetings that are monitored on a daily basis, not just waiting till month end. So I think it's getting those metrics back in front of the closer to the operations and the various leaders so that we have the opportunity to address the opportunities very early in the process. So I think that's another way we've kind of used our metrics to get closer to operations.
That's great. Deb, so if you had to kind of boil it down to, 3 things that have allowed you to be successful with your analytics capabilities or 3 components, do you have a way to kind of frame it that way?
Yeah, and I think we do have the advantage of our structure. I mentioned that in terms of the areas working together. So it's not just an analytic area kind of going out and saying, oh, here's some area to look at. We have people and teams that can take it forward and take that issue forward and bring it up through the organization. Another piece of this that it's kind of maybe a lesson learned as well is to try to get as much standardization as you can as earlier in your process, whether it be even naming conventions on payers, trying to make comparability, in terms of those actual plan names that you use in various systems, so that when you're accumulating that data, either to compare for your internal resources or to share with the payers or with your contracting arm, is in terms of ensuring that you have comparability in terms of that data and standardization as much as you can. So that's a big piece there. And then the other one is just sharing that data and communicating it with the operational leaders, and also having them understand those metrics, not just here's a number, but have them understand how those metrics work and how it's impacting their operations.
That's awesome. Okay, and then I got one last question for you, Deb. But are there areas that you've been able to kind of really hone your impact through leveraging advanced analytics? Curtis and Aaron talked a lot about advanced analytics and why it's valuable and what the techniques are. But I got to imagine if you had to paint a picture for, the operators on this call, what are the specific areas you've been able to really drive results based on analytics? Do you have a perspective on that?
Yeah, I'm going to give you 2. And the first one, I'm not going to go into too deeply because it's kind of, I'm going to say, pretty common. And that's looking at denials prevention and looking at denials in that piece. Sure. What I think is probably maybe a little more unique from the perspective is that when we use those analytics in terms of driving our revenue management results in terms of cash collections, whether it be on productivity. So using those analytics to develop more specific work lists and unique work lists to saying, okay, here's a specific item. And instead of this group of people maybe dealing with 20 different types of denials or 20 types of different accounts, to try to narrow their scope so they can really become experts and really see the trends and the issues more quickly. So using those analytics to kind of drive your the development of your overall operations. What do your work lists look like? What's the frequency of touches? Don't use a standard, don't have everybody follow up in 30 days. Maybe with this payer you can actually start following up on 15 days. And look at your results to say maybe there's another payer that don't bother until 35 days. so that you're effectively using your staff. And I think using those analytics to be more effective in your staffing and in your, particularly in the revenue management area, I think has been very effective for us in the last year and really resulted in improved cash collections from that side. So I think that maybe is a different aspect of using it, not just the write-offs per se, but kind of the throughput of your organization. I think it was Curtis who mentioned process intelligence, and maybe I don't call what we have done as much maybe as specifically as process intelligence, but learning more about that process so that we can be more intelligent in how we staff and their particular activities they perform.
I love that, Deb. And Deb, Lauren, we are out of time here, but I wanted to thank you, and I wanted to thank all the clients and colleagues on this call for spending the hour with us, talking through some of the challenges and successes you guys have had over the past year. I wanted to thank the Beckers folks, and I'll turn it over to them to close us out.
Thank you so much. That is all the time we have for today. But I also want to thank our moderator and our panelists for this excellent presentation, and also Deloitte for sponsoring today's webinar. And to learn more about the content presented today, please check out the resources section on your webinar console and fill out the post-webinar survey. Thank you, everyone, again for joining us today, and we hope everyone has a wonderful afternoon.